Hi, welcome back to the Faculty Factory podcast, Fact Chat. This is Kim Skorupski from Hopkins. Today, I wanted to tell you about something new for us and something we're pretty excited about in the School of Medicine at Hopkins, and that is the Academy. The Academy is a landing spot for newly retired faculty members on our medical campus. So let me tell you how that happened. Well, first of all, the medical campus that I referred to, that is where we have the actual hospital. It's the School of Medicine, the School of Nursing, and the School of Public Health. So any faculty member who retires from any of those three schools is eligible to join the Academy. Well, so how did this get started? About 2 years or so ago, our dean, Paul Rothman, put together a task force on late career faculty members or faculty members who are thinking about retiring, just trying to figure out needs of our aging faculty members. So two of our senior leaders in our school chaired this task force. It was pretty nice size, and they met for about a year. And Dr. Cindy Rand, who is our Senior Associate Dean for Faculty, she's our Vice Dean for Faculty is Janice Clements. She's her right-hand person. So Dr. Cindy Rand really kind of helped this task force envision what the dean wanted to happen and then what the faculty members wanted. So over about a year, the task force figured out what the needs of the faculty were and what would best serve our faculty members and our department leaders and the school, thinking about needs going forward. And like anything, I'm happy to share with you a report. If anybody's ever interested in seeing any material or information or template language, certainly reach out to me and happy to share that with you. But I just thought for those of you who haven't yet ventured into the arena of late career faculty or retiring faculty, I know some people have because we visited some of our friends, up in Philly, taking a look to see what they're doing there. So there's a lot of good stuff happening out there, but this was new ground for us. So after this task force wrapped up and Dr. Cindy Rand wrote a nice comprehensive report with recommendations to the dean, the report basically involved three components. We decided as a school to explore an early retirement incentive program or plan. That involved a lot of really heavy lifting with our finance and budget folks to figure out salaries and what our older faculty members are generating in terms of revenue from patient care and research and projected costs moving forward, and what the institution could offer in terms of incentives to retire and what kinds of benefits we could continue to offer our faculty members for health insurance and other resources we might offer our faculty members as they think about the next chapter in their lives and how to navigate the next transition stage. So finance and money and budgeting and retirement plans and incentives, that all kind of rolled under one recommendation, was to bring forth a proposal that would help our faculty members envision how they might be able to transition. So that was one huge lift. The second proposal, the second recommendation to the dean was to start an academy. So at Hopkins on the Homewood campus, the Homewood campus is what we refer to as our traditional traditional college, and graduate schools are up on about maybe 20 minutes commute time north of the medical campus. They already have an academy for retirees up there for all the other colleges. So we unabashedly stole from the way their system is set up there, and with a couple tweaks and adjustments. But we felt it was important to have a distinct academy for our faculty on the medical campus. So that proposal involved putting some resources behind an actual physical location and staff and building up an infrastructure to actually have a landing pad for faculty. So that's really exciting. And again, I can send you materials, especially the link to the website, if you want to take a look at what that looks like. But what we did was we renovated space in our library. There's a Welch Medical Library on our campus that is a beautiful old building. And there's a second floor area where one's called the West Reading Room and one's called the East Reading Room. And there's huge high ceilings, and it really has that definite feel of, the stacks and all the old reference books. But they're both study areas. So what we did is we took, I'd say, about 3/4 of the East Reading Room and had our architectural group redesign that with a private entrance. So you'd enter into this grand reading room, and then about 1/4 of the way into that room, there is now a wall, a 3/4 height wall, and a door that's accessed by a badge. And then when you walk into that beautiful space, we have a kitchenette that's got a nice espresso machine and a wine cooler and a refrigerator and, of course, nice cupboard space. But then we have a really beautiful sitting room that's got 4 couches and a beautiful coffee table and the bookshelves behind it. And in front of that is a long reading table with about 8 chairs. Our administrative staff person sits to the right of that in a beautiful little space. We have a small conference room that sits about 4 or 6 people can sit comfortably in there. And right adjacent to that little conference room is a small work area that has 5 desktop stations. So faculty can come there and do some work. We have a nice copier, of course. And then we have a little bank of locker space, full lockers and half lockers. And I think we've got now about 60 members where anyone is eligible once they retire to be a part of the academy. And then they have full access 24/7 to that space, where we're hoping that it can just, again, faculty can come to the campus, put their things in a locker, meet with some friends or colleagues, and just kind of feel welcome and have a nice space to meet. We invited our recently retired Vice Dean for Clinical Operations, Dr. Bill Baumgartner, to be our first chair of the advisory board. So we have a really vibrant and active advisory board that has about 40 members. It's very inclusive, and they meet monthly, and they've just started meeting, I believe it was in the fall, because we actually only had the ribbon cutting ceremony for the academy this past summer. I think it was July, where we actually celebrated our school's birthday. So that those meetings are about every month, and they've already started having guest speakers and social hours and gatherings and tours of library holdings and museum holdings. So they're moving right along there with the academy membership. The plans in the future, we have lots of plans and lots of discussion, as probably you've already thought about this. What do our retirees want? And there's certainly a really strong interest in maintaining connection with trainees, be that helping with education, lecturing or coursework or educational scholarship, and also helping to write grants or reviewing papers, perhaps being mentors and coaching. So we're going to roll those things out as we get interest and people willing to get involved and put some effort behind that. So we've got a lot of plans with the academy. Then again, that's the retirees. So I mentioned that there were 3 recommendations in that task force report. One was the retirement and early retirement incentive, which happened. I don't think I mentioned that early retirees were, for a period of time, there was a window where they got a one-time $100,000 gift, if you will. But that's happened, and now we're regularly, as people reach that age of tenure and age, that's going through smoothly with retirement planning. The second thing was that academy, having the physical space for people to develop interests and continue active engagement in their schools. And then the third component or recommendation that Dr. Cindy Rand put forth was programming. So the programming efforts are coming largely through the Office of Faculty Development, and it perfectly aligns with my interests. I'm a gerontologist by training. So it's been a real blessing for me to draw on my interests and strengths and love of older adults and aging with aging faculty members. And that's kind of also dovetails nicely with a research project maybe I'll talk about later, or the Late Career Faculty Project that originated from the Group on Faculty Affairs Research and Project Development Subcommittee. That's a really exciting project that I'll tell you about later. But this third component of programming has been fun. We did a panel presentation shortly after the task force got together and actually finished up. We did a panel presentation on folks who were recently retired or were thinking about retiring. And that was, we thought we might get a dozen or so people there. We had about 60 people, standing room only. We were shocked at how many people were curious to learn about other people's stories. So that was a great success. We had a pretty dry and interesting, but well attended, but pretty dry presentation by someone from the Social Security Administration. Apologies to our friends in Social Security Administration, but that was not really exciting, but it was information nonetheless. And then the most interesting thing we've done lately, that we just finished up a 4-part series that we call The Next Chapter. And that was Dr. Cindy Rand, Jennifer Haythornthwaite, and myself. And we had every other Thursday, every 2 or 3 Thursdays, again, there were 4 of them, from 4 p.m. to 6 p.m., we offered this session that was really interactive. We wanted to have lots of exercises, self-reflection, small group, dyads, where people started thinking about transitioning. So we started off with an orientation session. You know, we had an email blast to everybody at all the schools of public health and nursing and medicine, inviting people to come and start thinking. And that orientation session was pretty nicely attended. I think we had about maybe a dozen or 16 people. And then at the next 4 Next Chapter sessions, we had one on identity. You know, who are we? How will we introduce ourselves at parties and events if we don't say, I'm a professor? You know, what do you say? You know, how do you introduce yourself? How do you think about yourself when your whole status, your whole master status has been that of a professor? So that's a tough nut to crack. So we had, you know, identity, values, what's important to you, what is important to you then, what will be important to you in the future, visioning, what is your vision for the future? What are the possibilities? What are some things you might like to revisit in terms of hobbies or travel or family or friends or other skills or talents that you have that maybe you put on the back table during your academic career? And then the last segment of the Next Chapter series was putting it all together, and how do you make a plan, and how do you put some action items down, and how will you experiment and adjust your plan? And actually at that last session we invited our attendees to jot down their ideas about what their plan might be and what those action steps might look like. And then we promised to mail them their own action and plans and their plan in a year's time. And then they'll see, you know, reflect on where they are now, then, and a year based on where they were now. And who came to those Next Chapter series? So everyone was attended by, I'd say, around a dozen to maybe 20 people. And they weren't always the same folks at every session. So we tried to design the session so that they weren't hamstrung to each other. They could be standalone, but there was a common thread, you know, woven through each of the Next Chapter series, such that we wanted to really enforce the idea that retirement has changed. There's no longer just an abrupt end to the career. Rather, it is a transition that changes, that morphs, that may change, take subtle direction shifts depending on health and our partner's health and our family's health and all those other priorities. So that was the common thread, but each segment of Next Chapter could stand alone. So we had some members, we invited them to bring their partners. So that's all. We definitely want to have an eye on inviting a system, taking a systems approach and recognizing that faculty members don't make the decision on their own that involves their partners and their family members. So a couple, I'd say 2 to 3 of our participants regularly brought their spouses and their partners to the sessions. And we're going to be meeting soon, Drs. Haythorne, Thwaite, and Rand and myself, to kind of do a debriefing and look at the evaluations of those sessions. And our plan is right now to at least offer it once a year, perhaps twice a year, maybe once in the spring and once in the fall. But again, we're always open to feedback from our faculty participants and what their ongoing interests are. We're likely also going to have another panel presentation because we did find that people really love to hear other people's stories, which I think is just central to a lot of experiences, a lot of offerings we have for faculty. I'm sure just like us, I bet you had the very same or lots of similar feedback from your leadership programs and any programs you offer where faculty always say they really love the networking, the social support, the socializing. That's just so important for them to connect with each other. So we found that same thread through Next Chapter. We really built in a lot of networking and socializing. So, I forgot to tell you, before each of the Next Chapter series, we had a really nice spread. We had wine and coffee and hot hors d'oeuvres and cold hors d'oeuvres and nice appetizers. And every session we had a little bit of a different thing on the menu, but they were nice food and drink. And so we tried to create an atmosphere of casual, relaxed, friendly, informal atmosphere. And that we tried to build in that networking time before and then after. We didn't want to kill people with PowerPoint. We did try to keep the PowerPoints to a very minimum. And again, happy to share that stuff with you. And did a lot of interaction and exercises. They like to talk with each other and learn from each other. So I'm sure it's the same thing you experience in your program. So there's a lot to be had there, a lot more in the future that we're planning. And happy to share that with you. And just thought you might be curious to hear what we're doing for our late career faculty and our faculty members who have retired. Until next time, talk to you soon. Thanks for tuning in to Faculty Factory Podcast. The mission of the Faculty Factory is to build and support a community of leaders in faculty development who share tools, resources, wisdom, and encouragement in service to our faculty members, schools, and institutions. We encourage you to go to facultyfactory.org to find out more, get in touch with me, ask me any questions. Maybe you want to be interviewed on the podcast. Thanks for tuning in to Faculty Factory Podcast. We'll see you next time. The Faculty Factory podcast and website is sponsored by the Johns Hopkins University School of Medicine Office of Faculty. For more information, visit facultyfactory.org.